Last April, you founded the Black Doctors COVID-19 Consortium to help give medical care to help get vaccines to those hardest hit in the Philadelphia area. Can you tell us a little bit about that group and what motivated you to do that?
Sure. And it actually started with testing because, as we're talking about with folks who are overweight and obese, they are impacted more. But African Americans and Latinx folks in general had the highest positivity rates in the city, living in zip codes where COVID was 1 in 4, but yet all the testing locations were in affluent white neighborhoods. So here again, it was go get tested so you know your status, so you can isolate and not spread to others, but there was nowhere to get tested in your neighborhood. So that's why I founded the Black Doctors COVID-19 Consortium, to provide barrier-free access to testing, because at the time there was no vaccine, there was no cure. It was just early diagnosis and supportive treatment. And then subsequently with the vaccination, because people had seen us as a trusted voice and a trusted organization in the community, they came to us for their vaccine. And we stayed in the community. I think that's a huge part of access, is going to where the people are and not expecting them to come to you because you are a healthcare provider or a healthcare center. People need to come where they will feel empathy and be able to trust and develop a relationship. And that's what we were able to do. And in fact, over the 100,000 people that we've touched with vaccination and with testing, over 75% of them are people of color. And I recently heard with another news outlet, read, that the percentage of African Americans vaccinated in the United States in an urban city was greatest in the city of Philadelphia. And that is a testament to the work that we've done, providing culturally competent, culturally sensitive care with providers that are reflective of the population that we serve in their communities, and for it being barrier free. And I believe that that model is one not just for COVID testing and vaccination, but can be applied for all of the conditions, primarily cardiac disease, cancer, COVID, and casualties of violence. That can be that model for all the conditions that are at the highest rates of morbidity and mortality in our country.
We're almost out of time, but when you have a patient who comes to you and expresses vaccine hesitancy, as a physician, what have you found? What kinds of messages have you found seem to resonate the most as you're trying to help patients, and particularly patients of color, get vaccinated?
So the first, and what's always been for me, is to listen, is just to listen, because you can't assume that you know the reason why someone is not getting vaccinated. Sometimes it's a lack of education, or something that they thought was true was not. I recently had a young man, 20-year-old, say to me, well, it's not even FDA approved, talking about Pfizer. And I said, well, actually, it was initially emergency use, but now it is FDA approved. It was something as simple as letting him know that was enough for him to choose to get vaccinated. And so you have to listen, certainly be empathetic when people talk about the injustices towards African Americans and the healthcare system being untrustworthy to people of color, and let them know that you're not telling them to forget that. You're not asking them not to put emphasis, but this is a different time in our society. The pandemic is impacting, the virus is impacting everyone, and disproportionately Black and brown individuals, and reminding them of that. And then finally, there are some people that really respond to mandates. That really, when you say, if you don't get vaccinated by this day, you will lose your job, your ability to support your family. And for them, it forces them to look at the reason why they weren't receiving it and really question the validity of that reason. And with that, we have seen an increase in the number of folks coming to get that first and subsequently the second vaccine.